Yeah, it's HbA1c. Any other?
Postprandial glucose tolerance.
Tolerance test, of course. So these are the diagnostic tests. Sorry. So blood test. In blood test, it comes. We can check the random blood sugar, fasting blood sugar, postprandial blood sugar, and in fasting, that is FPS, it should be below 120 milligram per deciliter. And during random period means any time, and whenever we are checking, the blood sugar should be below 200 milligram. And OGTT, oral glucose tolerance test, the value should be less than, if it is greater than 200, we can assume that the patient is somewhat diabetic. But now in our clinical setup, or nowadays, that OGTT is not much used. Then HbA1c. HbA1c is not a specific diagnostic test, but it can define whether the patient there is diabetes, chance for diabetes or not. Actually, HbA1c is testing that. It is the test for checking the amount of glucose attached to the hemoglobin. That is to the RBC. Hemoglobin is present in the RBC. It's a red blood cell. So some glucose particles are attached to the RBC. So we are checking the amount of glucose attached to the RBC. So that is specifically HbA1c. That normal value is around 4 to 6%. If it is more than 6%, there is a chance for diabetes. Then comes to the complications. What are the complications of diabetes mellitus? So mainly for each and every condition, there will be an acute and chronic complication. That means immediate and latent complication. So the immediate complications include that, or acute complications include diabetic ketoacidosis. It's a well-known, otherwise called DKA. Other one is hyperosmolar hyperglycemic non-ketotic syndrome, or HHNS. And next one is hypoglycemia. These are the acute, means immediate complications. Then chronic, it's macrovascular and microvascular. So what is diabetic ketoacidosis? It is there. Diabetic ketoacidosis means there should be diabetes, there will be ketone bodies, there will be acidosis. So how it's happen? Actually, this happens when there will be increased sugar, means glucose in the blood, but the body is not able to use that sugar or glucose. Then as a counter mechanism, what the body does is, it will utilize the fat for its own metabolism. Instead of using this glucose, body starts using fat. Then the fat metabolism starts, and as an end product of the fat metabolism, the ketones will produce. Then ketone bodies, these ketone bodies will not eliminate through urine. Slowly it will accumulate in the blood, and it causes acidosis, metabolic acidosis. And that metabolic acidosis, that leads to increased urine output, increased electrolyte sodium potassium loss, and the patient will go to dehydration, and as a result, the dehydration as prolongs, the patient will go to coma and death. So this is the pathophysiology of diabetic ketoacidosis. It is mainly caused by type 1 diabetes. Once again I am telling you, it is caused by type 1 diabetes mellitus. So in type 1 diabetes mellitus, there is lack of insulin, but there is lot of glucose. But the body can't utilize the glucose because of the absence of insulin. So for the metabolism of body, instead of using that glucose, body starts using fat. And as an end product of the fat metabolism, ketone bodies will produce. And ketone bodies will not eliminate through urine, and it starts accumulating in the blood and causes acidosis. and due to hyperglycemia, means increased glucose even is there in the blood. It's not utilized by the cells. It's there in the blood. Due to that hyperglycemia, the osmolarity of the blood increases. Due to that, a lot of urine losses. As a result of that polyuria, what happens? The patient will go to dehydration, and as a result of ketone, there will be acidosis, and patient will go to metabolic acidosis that leads to coma and death. So that is diabetic ketoacidosis. Then comes hyperosmolar hyperglycemic non-ketotic syndrome. So what is this? What is this? Anyone have an idea? From the name itself, you can tell it.
Patient is asymptomatic.
Osmolarity.
Hyperosmolar means hyperglycemia. Due to hyperglycemia, increased amount of. I will tell you an example. If you pour some salt in water, what is the solution? It's a hypertonic solution. The osmolarity will be high, increased. There is salt is the solute, and solution means water is the solvent. So there will be increased osmolarity. Like that, when there is increased glucose in the blood is called hyperosmolar blood. Then hyperglycemic, increased sugar. The non-ketotic, that's the point. There will not any ketone production.
In urine or in blood?
No, if in non-ketotic, there will not be ketone production. There is no ketone production. So there is no ketone in blood and urine. So the pathophysiology is, it can seen in maybe seen in both type 1 and type 2, but more commonly seen in type 2 diabetes mellitus. What happens is, during this, the blood contains lot of glucose. It causes hyperglycemia. Then hyperglycemia causes initially increased amount of urine is produced. The patient go to bathroom and very often they go to bathroom because of increased urine production because of hyperglycemia. And at a stage, after that increased urine production, after some period, suddenly the urine production diminishes, and patient will go to dehydration. And dehydration, due to this dehydration, patient will go to seizure, coma, and here the difference between DK and that HSNS is there is not any fat metabolites. That's why there is no ketone bodies. So this is the difference between DK and diabetes ketoacidosis and HSNS. There in both the condition there will be dehydration, and in DK there will be acidosis or metabolic, especially metabolic acidosis. But in this HSNS there will not be acidosis can be seen, and other manifestations are almost same. But the laboratory findings we can diagnose that in HSNS the sugar will be higher than that of DK. It is greater than 600 mg per dl in HSNS, and blood glucose will be greater than 250 in DK. So there is one difference is there will not be any ketone bodies in HSNS, and the sugar value of sugar is higher in HSNS. And the pH, because of acidosis, the pH will be less in diabetic ketoacidosis, but it is normal in 7 point, no, but it is normal in HSNS. 7, oh no. 7, no, I am not asking you what is the normal pH. I am telling that the arterial pH will be less in diabetic ketoacidosis and it is normal in HSNS. And the osmolarity is, here it is hyperosmolar, so it will be great, and there will be there it is less. Other manifestations are almost similar. Then hypoglycemia, another complication. Hypoglycemia means decreased blood sugar level. The patient manifests with hunger, nausea, cold, clammy skin. There will be fatigue, sweating, that we can see in our clinical setup. Hypertension will be there, rapid pulse, and there is some unusual feelings, headache related to the cerebral function. And laboratory findings, there will be decreased glucose, and there will not be any ketone produced in hypoglycemia, and pH is always will be normal. So this is a picture of ulceration, wound ulceration of person with diabetes. So another picture, neuropathy. So this comes. Next comes to the macrovascular and microvascular. That are chronic complications of diabetes mellitus. In coronary arteries, these macrovascular complications are caused by atherosclerotic plaque. That means that tell me. Okay. These are the due to the chronic diabetes, the fat and sugar particles get accumulated in the blood vessel, and it slowly gets sclerotic, means hardened, and it will obstruct the normal lumen of the blood vessel, and it can affect each and every organ, wherever it can happen. So in coronary arteries, it leads to CAD. In cerebral arteries, it leads to stroke, and peripheral blood vessels also it can cause with peripheral vascular diseases called PVOD, peripheral vascular obstructive disorders or diseases. In microvascular, it means retinopathy in retinal capillaries. These are microvascular mainly caused in capillaries. Retinopathy in retina, it's causing retinal obstruction and result with the blurred vision. And neuropathy means the patient will lose the sensation, and it will the patient can't identify lose the sensation of the pressure areas, and that leads to diabetic ulcers. Nephropathy means it will cause kidney damage also. So